Many responsibilities you have at ACHA, as you mentioned, is the oversight of our nursing homes in the state of Florida, and so much of what we heard from you just now is about ensuring high quality health care. I know that part of the way that you've been able to ensure high quality health care, particularly through Medicaid, is through medical loss ratio, the MLR requiring that they spend, our Medicaid managed care providers spend a certain amount of their revenue on direct patient care. My question is about nursing homes and how we can raise the quality of care there, because right now I don't think that they're required to follow the medical loss ratio spending standard that we require of other Medicaid recipients. How do we raise the quality of care in nursing homes? Is MLR on the table? I know that's not part of the legislative budget request, but it's certainly a fiscal conversation related to accountability and raising quality of care.
Madam Secretary, you're recognized.
We have been having significant conversations with the nursing home industry related to funding, related to particularly their workload and workforce issues. That right now is one of the main things that we are working with them to come up with ways, talk about ways that we can help them get past that. Quality, always 100% a priority of my agency. And I think that as part of the conversations that we're having with the nursing home industry, absolutely the discussion is covering and involving what can we do to not only help you all with your workforce issues, but let's talk about quality initiatives. Because at the end of the day, that's what we and the taxpayers are paying for. And more importantly, the residents in those nursing homes deserve the highest quality care.
Representative Smith, you're recognized for a follow-up.
Thank you, Chair Avila, and thank you for having those conversations. Of course, so medical loss ratio is not a standard that the nursing homes are required to comply with. I want to switch gears to the Agency for Persons with Disabilities and the wait list, particularly around some recommendations that you've made, actually that ACHA made in 2018 to the legislature around the concept of Medicaid buy-in. My understanding right now, and I just don't know if it's cost effective, so I'm wondering if this is addressed anywhere in your proposal. If you're a Floridian living with disabilities who is enrolled in services, there's a certain income threshold that you cannot exceed to maintain your benefits. So if you are offered a job promotion with a substantial salary boost, the state essentially disincentivizes you from accepting that promotion or accepting a job entirely, because you would then make an income way higher than the maximum for benefits, and you'd have to disenroll from the services you need to maintain your quality of life. Is that part of your legislative budget request this year to try to incorporate more cost sharing with Floridians with disabilities who need to be incentivized to go to work as opposed to disincentivized as many of them are right now?
Madam Secretary, you're recognized.
Specifically, our LBR doesn't cover that particular issue, but I will say that the home and community-based services increased FMAP plan will help certainly our folks who are being served by APD and in that community. As you heard me mention earlier, we are going to have stipends going to those providers to enhance the services that are provided. But I will say that that is something that you bring up that I would like to be able to take back to my team and talk a little bit about, not only with my team, but candidly with the team at APD as well.
Thank you.